What I would like to do today is talk about probiotics from a practical point of view. Specifically, what I'm going to be looking at is recommendations for probiotic use, both from a nutritional perspective as well as a clinical perspective. The area of probiotics with clinical recommendations has actually been developing quite a bit over some recent years, and we've seen some medical organizations as well as other independent groups try really hard to do an evidence-based assessment of the studies that have been done and come to conclusions about when probiotics can be used and which ones can be used for what conditions. And I just wanted to point out what types of evidence is typically used when you're making a nutritional recommendation compared to a clinical recommendation. And for nutritional recommendations, it's not uncommon to use observational data, which for clinical recommendations, typically we look at randomized controlled trials and then meta-analyses of those trials to try to come to a conclusion on the totality of evidence. But there are certainly observational trials that have been done with yogurt and other foods that participate or contribute to the understanding of what nutritional recommendations could be. What I wanted to point out was the results of a workshop that we conducted at a meeting of the International Scientific Association for Probiotics and Prebiotics. And what we did is we pulled experts together to discuss the prospects for public health and nutritional recommendations for both pro and prebiotics. And we looked at the different types of data that were available at that time, and this is published a couple of years ago. And what we found was that there was evidence out there for either yogurts or other fermented foods, or usually fermented dairy products, or specifically on probiotics, where you did have randomized controlled trials on probiotic strains. So the types of endpoints that there's data on include healthy gut function, healthy metabolic function, healthy immune function, reduction of common infectious diseases, and a subset under that reduction of common infectious diseases is an endpoint that has been looked at in a few studies, which show that probiotics actually can reduce antibiotic prescriptions, which was an endpoint that was followed through those studies. What I will just introduce right now is the idea that I think there's consensus in the scientific community about probiotics microbiology, that the different probiotic strains, in fact, can be very different from each other. And you cannot make an overall assumption that all strains are the same and that they necessarily will all function in the same way. Having said that, we also know that there's evidence that shows that very often they do function in similar fashions. And so what we have to grapple with if we're talking about making a nutritional recommendation for the probiotic field is whether or not it's okay to pull data on a variety of different strains together to make a nutritional recommendation. In nutrition, it's common to put forward a concept of nutritional benefit for a category of foods. And even though members of the category may function differently, and the example that this person gave was that the category of whole grains includes members that lack evidence specifically of function. So I wanted to point out a paper that I wrote actually with a colleague of Paul O'Toole's at the APC in Cork, Ireland, where we were talking about rethinking probiotics and rethinking this concept of whether or not all effects need to be considered strain-specific effects, and the effects of the idea of pulling together the information on the human microbiome, which is certainly suggesting that diets that contain live microbes may be beneficial. And one of the quotes I liked from this paper is here: "It may well be that the best advice to healthy consumers interested in probiotics is to consume a bolus of safe microbes, and many different microbes may serve this purpose equally well." And that may be the case, more importantly, for the healthy general population. Now, one thing I do want to talk about very briefly is the idea of where fermented foods, because we're talking about nutritional guidelines, we're talking about foods, we're not talking about specific ingredients. And I just wanted to mention that this is a framework that came out of another International Scientific Association for Probiotics and Prebiotics effort, which was a consensus panel on the definition of probiotics. And what they did is they mentioned that fermented foods actually are not considered to be probiotics per se, because we don't have the evidence yet that really shows convincingly the health benefits that they may have. I wanted to point out that this is a quote that came from a report of the 2010 dietary guidelines out of the United States. And what that report did, and I thought this was noteworthy, is that they actually called out probiotics and prebiotics, and they said that foods high in probiotics and prebiotics are linked to health benefits, and they talk about fiber being a prebiotic. Then many probiotic foods, such as dairy foods, are also linked to health benefits and are recommended for inclusion in the diet. Now, this recommendation was out of the advisory committee. It did not make it into any kind of final recommendations for the dietary guidelines that were put out. But at least they acknowledged pro and prebiotics. Then if you look forward to 2015 guidelines that they've finalized just recently, what you see is a document that came out of the advisory committee that has no mention of probiotics or prebiotics. So in a way, it's a step backwards 5 years later. And the only nod to the microbiome in the entire report, which is several hundred pages, is the committee considers the microbiome to be an emerging topic of potential importance to future dietary guideline advisory committees. And I want to point out just a couple of other efforts. These were headed up by Dr. Seppo Salminen at University of Turku in Finland. And he produced the following 2 papers. And this paper basically looked at what kinds of recommendations on either yogurt or probiotics were made within the EU. And just to summarize, out of 22, I think that's 38, isn't it? 38 EU member states, 5 have national nutritional guidelines or recommendations that include either probiotics or prebiotics or fermented foods. And then Professor Salminen took this effort, this survey effort globally, and he looked at a variety of different countries that he was able to access the databases for and asked whether or not there were any recommendations in non-EU countries that had anything to do with probiotics or fermented foods. And these are the countries that he looked at. The countries in red, Canada and Thailand, were the only ones that had any recommendations or mention of probiotics. So let's move now into clinical recommendations. First of all, the one point I want to make is we need to understand that when we consume a probiotic, what we are doing is we're taking the probiotic and putting it into a person, and not all people are the same. And I think it's important for us to realize that with probiotics, and this is true with drugs and even diets of different types, that you can expect individual responses to that particular probiotic. And I just am pointing out a few factors that may in fact influence the ability of a probiotic to have a benefit in a person who's taking it. And I think diet is certainly one of them. There's good evidence that diet affects the microbiota. The colonizing microbiota that's native to each individual person could influence whether or not a probiotic might be effective. And finally, each person's genetics, the individual characteristics of each person. But let's look at what evidence exists for probiotic benefits. What I've done here is I've divided different types of benefits into medical benefits and benefits that might be realized for the generally healthy population. And with the medical benefits, we have benefits such as treating acute diarrhea, reducing antibiotic-associated diarrhea and Clostridium difficile, prevention of necrotizing enterocolitis in preterm infants, reducing symptoms of irritable bowel syndrome, and extension of remission for ulcerative colitis and pouchitis. But there's also benefits that have been shown for the generally healthy population, such as improved gut function, surrounding motility, luminal pH, reducing digestive symptoms, reducing upper respiratory tract infections, both duration as well as incidence, improved blood lipid profiles, reduced crying time in colicky babies. Certainly not all strains will work for all conditions, and so you have to take this very broad swath with an understanding that the context is that not all probiotics are going to work there. The reality of it is that clinicians are using probiotics. And I think to some extent the regulators kind of don't acknowledge this. I think they think that probiotics really haven't yet gotten to the point where people consider them of value to use. But in the United States, these are the results from a survey of academic hospitals. So these are just hospital formularies associated with universities. And they were surveyed and asked whether or not they carried a probiotic in their formulary, if so, how many, and just other information about the probiotics. And what they found was that 87% of academic hospital formularies carried at least one probiotic. but many products and formularies were not maybe the optimum probiotics for the particular uses that they were given. So let's look at a way that would be a more evidence-based approach to what kind of probiotic to use and what evidence is the strongest to support it. So I just wanted to go through very quickly. These are lists of recommendations that have been put out by different organizations. So the uses include pediatric mild, for use of probiotics for pediatric mild ulcerative colitis, for lactose intolerance, for allergy prevention, and for colic. And those recommendations have come out of organizations such as the European Society for Pediatric Enterology, Hepatology, and Nutrition, or ESPGHAN. Live yogurt cultures were given an European Food Safety Authority approval for a health claim on foods for their ability to improve lactose digestion. I wanted to spend just 1 minute or so talking about evidence that didn't really show up on either of those previous two slides, and that has to do with the use of probiotics for the prevention of necrotizing enterocolitis in preterm infants. There was a Cochrane collaboration meta-analysis done, and that really is the highest standard meta-analysis that is even available, and it's got a very strong reputation. And what they said about the data on 24 trials that have been done on different probiotics was that the probiotics are highly effective. They had a 57% decreased risk of developing severe neck in the children that were in the study, and a 35% reduction in risk of mortality. So these are very compelling numbers with tight confidence intervals. Half of the studies were rated as high-quality studies. The products were safe, no cases of probiotic sepsis. And this has led to several countries actually adopting this, and I know New Zealand, Australia, Finland, and Japan have started to use this as standard of practice. This particular guide is available for products that are sold in the United States, and there's also one that's for Canada. And I believe they are trying to expand to other geographical regions, but so far it's only in those two regions. But it's a very interesting process where they have reviewed the evidence on a variety of different endpoints, which are shown here. I'm not going to list them all, but includes things like oral health and functional pain and constipation. And what I would like to point out is they also provide 3 levels of evidence, level 1, 2, and 3. And I would just say that level 1 is probably the level of evidence that we would look for, where you're looking for at least one properly designed randomized controlled trial. And then this is the slide that I mentioned from that European Society for Primary Care and Gastroenterology. And they put together a very nice document that talks about probiotics for GI use. And they talk about high, moderate, low, and very low grades of evidence for the effect. And they talk about what kind of indications, so it includes things like symptoms for abdominal pain in IBS, prevention and reduction of diarrhea in patients with antibiotics, including helicobacteria. So in conclusion, globally, few nutrition guidelines for probiotics or foods with live microbes exist. Clinical recommendations, however, are emerging, and they are backed by clinical and independent organizations using objective evidence grading approaches. The best evidence is for antibiotic-associated diarrhea, symptoms of IBS and other digestive discomforts, colic, necrotizing enterocolitis, and common respiratory tract infections. Traditional probiotics are typically very well tolerated by the general population, but I think it's fair in a clinical setting to use caution when recommending probiotics for vulnerable populations. Thank you.